Well, first of all, thank you so much for inviting us and for inviting us to present here to share our findings around financial disadvantage in migrant households and a little bit more about the practical solutions and initiatives we're taking forward through the policy laboratory. Some of you will be very familiar with this. Some of you have participated in this research, and it's really nice to see some familiar faces here again. Yeah, before I sort of go into too much detail on that, I just wanted to share a little bit with you about MPS and what we do. So Migration Policy Scotland is an independent think tank founded in 2021 to fill an urgent need for greater capacity on migration in Scotland, especially in ways that include a focus across the full spectrum of migration routes and populations. So we offer informed responses to migration and the opportunities and challenges it brings. Our work combines learned and lived experience through our partnership projects and our lived experience panel. So our project on tackling financial disadvantage in migrant households, which is the report that you can see there on the screen, it grew in part out of conversations in our LEX panel, and it's delivered in partnership with migrant-facing advice and support organisations, one of which, as you'll see, is GREC, who are also represented here today, so that's lovely. In terms of the urgency of this work, migrants' experiences of financial disadvantage in Scotland is not a niche or a specialist issue. It's really central to achieving Scotland's ambitions to reduce poverty and to develop public services that leave no one behind, based around no wrong door principles and a commitment to deliver person-centred support. So migrants are a growing proportion of Scotland's population. More than 500,000 people living in Scotland were born outside of the UK, and they're disproportionately affected by poverty and financial disadvantage. So the Joseph Rentree Foundation's latest comprehensive report on poverty shows that 53% of children in minority ethnic families are trapped in poverty, which is more than double the overall rate of child poverty. Now, since 77% of Scotland's working-age minority ethnic population are born outside the UK, it's fair to say that many of these children will be living in migrant families. Now, this actually tallies with UK-wide statistics, which show much higher rates of poverty amongst children whose parents are born outside the UK, and they're significantly more likely to live in poverty. So that gap is actually widening, and it makes very little difference how long the parents have been living in the UK. And actually, one thing that we found and was very striking in our research is that even migrants who have been living in the UK for 5, 10, 15 years and have acquired British citizenship, they're still being supported by migrant-focused organisations, which suggests that the problems and the challenges they're facing, are remaining consistent across that time. So working migrants are concentrated in areas of the workforce where wages are quite often low, contracts less secure, and their labour market outcomes are generally poor. So, migrants tend to be overrepresented in health and social care, in agriculture, and in hospitality. And these will all be industries that, will be very familiar to people here. So these costs and financial pressures are generally compounded in rural areas by less varied job market, fewer services, all the reasons that you're all very familiar with already. So what these statistics also tell us is that the issues around financial disadvantage experienced by migrants in Scotland go beyond the extreme sort of thin end of the wedge that is destitution among asylum seekers and refugees. So these groups make up less than 10% of our migrant population. So our research focused on the other 90% who don't have access to the suite of support packages that are aimed at refugees and asylum seekers. So our research group was working migrants, including those with EU settled status or pre-settled status, those on work or study visas and their dependents, and those with indefinite leave to remain. And we found a lot of evidence of financial disadvantage and great difficulty in accessing those pathways out of poverty. So this map will give you an overview of the kind of geographical reach that the research covered. The purple pins that you can see represent where migrants were based, people with lived experience of financial disadvantage. And the red pins that you can see are where we talked to advice and support organisations. And the names in bold are our project partners who are helping us to deliver this project. So our research gathered insight and information, both from support and advice organisations and from migrants with lived experience of financial disadvantage. And whilst the ultimate goal of the practical initiatives we're developing is obviously to alleviate those financial disadvantages and their consequences, we were also very struck by and would like to improve the often very difficult experiences of those on the front lines of advice and service provision. So you can see here the methods that we use to engage with a wide range of organisations, both specialised, migrant-focused and more mainstream services and advice organisations, and to gather insights from migrants with lived experience of financial disadvantage. So there's more details in the report about the sort of spread of nationalities and visa routes, ages and genders and employment experiences. We found that a lot of people who we spoke to were very highly qualified and were, significantly underemployed. A lot of people were graduates or postgraduates, and they were often trapped in the kind of low-paying, precarious work that I've often mentioned. So as part of the research for this project, we engaged with 5 organisations that were either rurally based or which were rural branches of national organisations, and some have become subsequently involved in our policy work, building new solutions and interventions to mention these challenges. So I'll sort of, again, keep this as brief as possible, but they're all in the report. I'm very happy to answer any questions you might have about them. The quotations that you'll see on the side did come from migrants who are living rurally. In a nutshell, so migrant households are experiencing particularly high costs for housing, utilities, food, and so on, in similar ways to other low-income households. But they also face additional significant costs as a result of the migration system. So this includes things like visa renewal fees, the NHS surcharge, and there are also higher costs of keeping in touch with and maintaining obligations to family and friends. Migrants also have significantly less access to some of the common means of mitigating these costs, such as informal childcare networks, staying in parental homes, access to lines of credit and direct debits, and so on and so forth. We found lots of evidence of households lowering costs by going without food for adults or rationing heating and hot water. For some, this was impacting negatively on physical and mental health, causing issues such as damp in the home, and parents were particularly concerned about impacts on their children. For migrants based in rural areas, there were other more specific needs and challenges. We found that transport and housing were particularly difficult for migrants to source. I'm sure this won't come as a surprise. So just for an example, converting a driving licence to a UK driving licence can be costly and administratively challenging. And migrants also faced higher car insurance premiums, if they retain their foreign driving licence. So for those who are waiting or for whom costs are prohibitive, relying on public transport severely limited their ability to find employment and suitable employment. Similarly, in rural locations, there was older housing stock, lack of social housing options, and distance from jobs and services, all increasing costs. Support workers in parts of rural Scotland also told us that a lack of local contact and social connections can make it harder for newcomers to access decent and affordable housing, as well as jobs, and this compounds financial pressures and exclusions. So migrants face considerable barriers and challenges to employability and are at higher risk of underemployment, precarity, and exploitation. The challenges they face are not just about getting any job, but about having a good job that pays a living wage and is suited to their skills and qualification. And they do require specific advice and support to overcome these. So in the Scottish approach to poverty reduction, we have reducing costs and increasing incomes through employment. And the challenges I've just mentioned, I think, show the barriers to those particular strands. And a third strand alongside those is improving access to incomes and social security. For many migrants, this pathway is severely restricted because of NRPF, or no recourse to public funds. So this is a condition associated with most visas granting people the right to live and work in the UK. So 2.6 million people in the UK are subject to an NRPF condition at the moment. And yes, The rules surrounding NRPF can be complex. They're subject to change. The penalties for claiming something you're not entitled to are severe. So any breach of the rules, even unintentional, even very minor, can result in visas being revoked and being required to leave the UK. So the key point I want to make here is that for a considerable proportion of migrants, it removes the safety nets that other lower income households might rely on, including access to in-work benefits, to local authority housing, the child benefit, the Scottish child payment, Best Start grants, so on and so forth. So that said, NRPF does not apply to all migrants, nor to all kinds of assistance, but the severity of the penalties for transgressing NRPF restrictions and the very complex and often changing nature of the rules have contributed to a kind of NRPF creep, where both migrants themselves and those advising them can be fearful of accessing services or advice that are publicly funded, even though those funds might not be designated as public funds for immigration purposes. And even though this is not all part of the NRPF restrictions, or they may assume that all migrants have no access to a benefit when many EU citizens, for example, may well be eligible to claim. There might be mixed households where not everybody is subject to the same migration restrictions. It can be very complex to navigate. We've heard examples of people who are too frightened to use food banks or advisors, unsure of whether they could allocate places on a publicly funded employability schemes. We've also heard examples, especially in rural areas, of services finding creative workarounds, combining different sorts of assistance, for example, so that people could access a food bank over a prolonged period in order to help them through a crisis situation where someone without an NRPF restriction would have been able to get other kinds of support. And Agnieszka, the story that we have on the slide here is a composite of different stories that we heard through the part of the research. The main bulk of Agnieszka's story was based in a rural location. So, I mean, these are unfortunately issues that strike all over the country. This is sort of what we found. We found that migrants encounter a sort of divided landscape of service provision, which at the moment is not very well suited to their needs and is not best set up to enable them to maximise incomes, navigate systems, or increase employability. And I just want to make absolutely clear that this is not a criticism of any specific organisation or group of organisations, but it's just, it's important to recognise that the wider system doesn't see migrants as a significant group in need of support. Not through necessarily the setting up of even more specialist and bespoke programs and initiatives, but just through including and incorporating their needs for support within a support landscape which is aimed to leave no one behind. So these are our findings from Scotland as a whole. We know rural environments aren't the same, and there are generally a lot less organisations that focus specifically on issues relating to migration. And we'd be really keen to hear your thoughts on this and how this picture might be different in the context you're working in, and how the solutions we're developing may need to adapt to that. And I will get to those in just a moment. What we've noticed through our research is that for migrants in need of advice and support, the current landscape of provision exists in these two parallel strands. So on the one hand, you have migrant-focused organisations and charities, mostly with precarious funding and limited reach into publicly funded or mainstream programmes. On the other side, you have a mixture of public and third sector organisations providing employability, income maximisation services, and many of them are more able to tap into mainstream resource and schemes, or even in some cases provide direct financial assistance. There are absolutely crucial strengths and skills and knowledge on both sides of this landscape. But while organisations are generally well networked, among themselves, we've found that across this gap, there is much less connection taking place. This means that mainstream organisations are less able to benefit from the knowledge of and reach into migrant communities that migrant-focused organisations have established. And conversely, migrant-focused organisations often struggle to make effective referrals and to assist their service users to access mainstream services more fully. So part of the solution that we're looking at now is about building bridges across both sides of this landscape to connect better, to provide better services, which are sort of able to see the needs and challenges and to support and meet them that migrants face as individuals, parents, households, and families. So in order to do this, we designed a policy laboratory process to look and see what we can do to improve this situation. So as part of our reporting from the project and also in our wider engagement activities, we're pursuing specific recommendations to government, local authorities and employers. And we're working particularly hard right now to ensure that migrant needs and challenges are properly considered as the Scottish Government develops a new tackling child poverty strategy, as well as building relationships and inputs to COSLA, improvement service and third sector interfaces, especially around employability support. So the focus of the policy lab, though, is perhaps a bit more relevant to this group, and it's where we're seeking collectively to come up with new ideas of working, ideas for better systems, agreements that would help to build a better, more joined-up landscape of services, which are able to provide a no-wrong-door approach and person-centred support and advice for migrants. So we spent the first 3 months, which is sort of November to January, in what we call the discovery phase. And this was spent working out the best areas to focus on making changes through a lot of engagement with participants, researching existing approaches and initiatives. This fed into 2 key themes and a range of potential ideas for outputs, as you see here. And when we moved on from this in February, we ran this, became into our sort of delivery phase. So in February, we ran 2 themed events, bringing together more than 20 organisations, with participants having agreed to commit time after the events to feed into the development of outputs, which I'll cover in just a moment. We worked closely together to break down into more detail the challenges and possible solutions to those and to come up with feasible and effective solutions. So we identified 5 Pathfinder initiatives, which we're now taking forward over the coming months, and this work will culminate in a showcase event at the end of August, where we'll share our learning, highlight the progress we've made, and seek wider support from policymakers, funders, and other decision makers. So here we are. These are our planned outputs and pilots. I'll cover them quite briefly because I can see I haven't got a huge amount of time left. But first of all, guidance for financial health checks. If any of you aren't aware of these, this is where you sit down with an advisor and you work out where your outgoings, your incomings, how you can maximise your income, and maybe help with budgeting, more financial advice. And what we are really keen for is for this to be tailored to migrants and migrant households. So, for instance, awareness of entitlements. More awareness of things like I mentioned before, mixed households, where people might have different restrictions on what they can earn, where they can work, and so on and so forth. We found that's quite important. The triage system is about making more effective referrals and warm handovers. There are similar systems at the moment happening in Glasgow. We've had some interest in more rural areas, and we're looking forward to sort of setting up a pilot system where you have a key person and they are well networked into the local service provision landscape, and they know who's doing what support they offer, and what information they'll need in order to do their job properly, and sort of helping people navigate this landscape, basically. Guides on accessible and intercultural communication. What we have found actually is that it's not so much about interpretation and language support, but about confidence dealing with people whose first language isn't English. And this can involve various strategies, such as speaking more slowly, not using idiomatic language, explaining things. Some of these systems can end up being very complex, and just sort of thinking about how to break them down as simply as possible. That's what we sort of mean by intercultural communication, and also strategies for communication, such as using visual aids and prompts, and translation apps, just sort of helping people be a bit confident in communicating more effectively. The cheat sheets and service maps, obviously, service provision landscapes can be complex for migrants to navigate. They don't always know what they don't know. in terms of who can help them with what issue. And it can change depending on region as well. So what we're coming up with is a range of templates that can be locally adapted. Some with a little bit of pre-populated information, but the idea is that these are flexible. They can easily be changed and adapted and updated in different areas in order to help people navigate these systems as helpfully as possible. And finally, in terms of training, we are really hoping that migrant-focused organisations will have a suite of training methods where they can provide their knowledge and experience to mainstream support organisations, just with a little bit more guidance on the challenges that migrant households are facing, like the specific restrictions that are in place. And we're also hoping that will help, build the bridges between these sort of divisions that we saw before. But again, I'll be happy to say more about that in the Q&A to answer any more questions about that. And I'd be really keen to hear how people think that will be helpful in a rural context as well. Okay, 11 o'clock. I'm going to stop here. And again, thank you all so much for inviting us to speak today.